Good evening. I hope you are all doing well. Please, can you hear me? Okay. All right. It's been a while since we met. Uh, Dr. Ewa, um, due to some challenges, the plan for this semester, the way we had arranged the classes, couldn't um go the way we wanted it to go. So he had to finish what he needed to do. Then I will come in. So for the next couple of weeks, um we are going to be meeting. I am going to be meeting you on Saturday evening. All right. So this evening, whilst he was meeting, I was also sharing um the slides that we are supposed to be, some of them that we are supposed to be discussing. So what I intend to do this evening is to um have sort of a summary, okay, a summary for all of us, but I will have to, um, the nursing students, the final year nursing students are having an exam where I have to travel to Keta this evening. So we'll end the class around 7:30, 7:45 to enable me to join the bus to uh, Keta. All right. So that's why I was even asking if we could meet earlier. All right. So over the past few weeks, I've shared up to lecture 5 with you on drug absorption, which we discussed a little bit, and then also on drug distribution, metabolism, and then excretion. So I am going to sort of give a summary again with sort of to sort of remind us about drug the absorption, what we discussed. Okay, so we'll start with that summary, and then hopefully we would also be able to take a look at some pharmacokinetic parameters and how important they are for us to know as nurses. All right. If so, I'm going to share my screen, and I hope you can see the screen now. Okay. So on this slide, um, is sort of a summary with a diagram trying to explain pharmacokinetics. We already know what pharmacokinetics is, uh, and that it is what the body does to the drug or the movement of the drug throughout the body. What happens to the drug from the point where you administer it up to the point where it is eliminated from the body. We also got to know that there are 4 main processes. We have absorption, distribution, metabolism, and excretion. Like I said, in some books, you are going to find metabolism and excretion put together as elimination. So when we say drug absorption, what we mean is the fact that is the process whereby the drug is absorbed or is moved from the point where you administer it into systemic circulation. So here, there are several factors that we need to be um, thinking about. One of them is the route of administration, because depending on the route, the drug would either be absorbed faster or slower. And depending on also the route, you are going to see you determine whether you have to give the drug depending on the patient's condition. You determine which route you even have to use. Among others, we have the age, we have molecular size of the drug or the particle size of the drug, drug formulation. All of those ones affect drug absorption. All right. So for drug absorption, when it comes to um, the parameters, for the routes, let's look at the routes. We have where absorption takes place. We have the enteral route where it's mainly the oral and then the rectal. Here, the drug is absorbed mainly in the small intestine. Um, then we have the parenteral routes that looks at all the other routes that absorption will occur outside the GIT. So from the intramuscular, venous, intrathecal, topical, inhalational, all of those ones are parenteral routes, including sublingual and buccal, because absorption for the sublingual route and the buccal route is through the mucosal membrane under the tongue or in the buccal cavity. All right. So it will not go through the GIT, meaning it will not go through the stomach, the small intestine, and the rest. Now, there are two things that's under absorption I want to remind us all. One is first pass effect of first pass metabolism or pre-systemic metabolism. All right. And this is the metabolism that happens before the drug is absorbed into systemic circulation. All right. Um, and this one, drugs that would use the oral route and the um the rectal route, they would even the rectal routes, I need to be cautious there. So for the rectal route, it is the drugs that will be administered in the upper rectum that would go through the first pass effect. So drugs that you ingest, as in you swallow into the stomach and it gets into the small intestine, before it gets into systemic circulation, the drug will be absorbed into systemic circulation. It is absorbed through the portal system to the liver. And that is where the first pass metabolism takes place before the drug is absorbed and distributed into the whole body, including the size that the drug is supposed to do its work. So, as a nurse, you need to be aware that when you are giving you are giving the patient the medication. Now, you need to be aware which route, as a midwife, forgive me, as a midwife, you need to be aware which route is going to go through the first pass effect. What is the effect or the overall effect when drugs go through the first pass effect? Okay, you need to understand that. The reason why you need to understand that is that if a drug goes through the first pass effect, it affects the amount of drug that finally is made available to the rest of the body. Because when the drug goes through the liver and it undergoes the first pass effect, the drug is going to, some of them is going to be metabolized and it will be lost. It will be excreted. Some of it may leave unchanged. For some of them, for certain drugs, that is when it is even made more active. So all of these things, aside the fact that the stomach has gastric juices, it also has enzymes, the small intestines as well. They all would affect the amount of drug that gets finally reaching the systemic circulation. And for that matter, as a nurse, as a midwife, you need to understand that when I'm giving this patient this medication, what can I do? Or based on the condition of the patient, do I want the drug to go through the first pass effect? If I want the drug to go through the first pass effect, then yes, you can go through you can use the oral route or the rectal route. But if you don't want the drug to go through the first pass effect, you want the drug to be absorbed straight into systemic circulation as fast as possible, because maybe the patient is eclamptic or something. Then you should think of the parenteral route. Okay, the parenteral route. Then also, sometimes you have patients, and then like typically what happens in most of our facilities, when we have patients who come in with pre-eclampsia or eclampsia, and they are in uh, conditions where you cannot they become either semi-conscious or unconscious, and they may pass an NG tube, or the patient cannot swallow or something. We tend to crush nifedipine and give it to our patients. Okay, we tend to crush it. Now when you crush it, you destroy most of the drug, aside the fact that the drug would be destroyed by the gastric juices and the stomach acids, the enzymes that are there. Most of the drug will be destroyed. It will not get into systemic circulation for you to see the effects of the drug. Okay, so you need to understand as a midwife, what can I do in such situations? Then you should think of routes that you can get the drug absorbed into systemic circulation without going through the liver for first pass effect to happen. Okay, so that is one of the things that we need to understand, that absorption. Another parameter that we need to understand is what we call bioavailability. Bioavailability. And I want to share a slide, another slide with you, so that okay, so that we get what I am saying well. Okay, so I hope you can see this diagram here. All right. Please, can you see the diagram? Hello? Can we see this diagram? All right, good. So now if you look at this diagram, we are talking about another pharmacokinetic parameter, which is bioavailability. And bioavailability simply means the amount of drug that finally reaches systemic circulation. Okay, we are looking at the amount or the fraction or the percentage of the drug that finally reaches systemic circulation. Like I earlier said, if you give a drug orally, this drug is going to please give me a second, I'll be with you. Hi, sorry about that. So let's continue. So anytime you take any drug, okay, one thing you should know is that it doesn't matter the route. Not all of it is going to reach systemic circulation. Okay, because the body is such that it contains several enzymes in the blood, in the GIT. Okay, so once you administer any drug, now when they are developing the drugs, they take all of this into consideration. Okay, anytime they are administering, they are developing a drug, all of this is taken into consideration, and so the doses that are, recommended for our patients, all of this is taken into consideration. And okay, and so when we give the patients the medications, Yes, not all of it will be absorbed, but what at the end of the day reaches systemic circulation may be enough to start the therapeutic process. Okay, so when we say bioavailability, we are talking about the amount or the percentage or the fraction or the part of the drug that finally reaches systemic circulation. Sister Philomena, you can unmute. Is there a question?
No, sister, please, can you kindly increase the volume a little bit?
My
Seems your
volume
voice
is
is far to
already
hear.
100% too.
Oh,
Try and
okay.
increase yours. I can show you mine. It's already 100%.
Oh, okay. Thank you, sister.
Try increasing your volume and let's see. Okay. All right. So, let's go on. So, if you give a drug orally, the dose that you start with, the amount that you start with is not the same amount that will reach systemic circulation. Okay. If you administer a drug intravenously, yes, this one is going into the blood straight away. But even in the blood, in the plasma, we have drug metabolizing enzymes. So sometimes, or if the drug is supposed to be metabolized by the enzymes that are present in the plasma, they would be metabolized. And so whenever you administer any medication in the using the internal route, you have some of it that will be destroyed by the gut. So the gastric juices, the enzymes that are in the stomach, the um, hydrochloric acid that is there, they are all going to affect or destroy parts of the drug. Some of the drug will not be absorbed at all, at all. Some will be destroyed also by the gut wall. And when the drug goes through the first pass effect, some of the drug will be destroyed also by the process of the first pass effect. And so finally, what will reach systemic circulation is much lower than the what you started with. So for this parameter, it's not about a particular route. Every route has the bioavailability, and every drug, you see it written. Bioavailability of this drug is so and so. We use numbers, okay, to denote it. Either is 0 to 1 or 0 to 100%. Okay. Ideally, the IV route will give you 100% because the drug is going through systemic circulation. You are putting the drug directly in the systemic circulation. Okay. So that will give you 100%, but that is theoretical. Like I said, there are some enzymes that are present in the plasma. And so some of the drug can be metabolized in the plasma. Okay. And so these are the ranges. These are the ranges. So for the oral route, it can range from 5 to 100%. Okay. The rectal 30 to 100%. The inhalational 5 to 100%. The transdermal 80 to 100%. So if you let me show you a slide so that you understand what I'm talking about. So you can have the bioavailability if you happen to have the pharmacokinetic profile of the drug. Okay, you can get to know what's the bioavailability of the drug, and then you can just a minute. I want to show you drug information. Not showing. So I am going to show you what I am talking about. And then, okay. So this is information about acetaminophen. Okay. This is one of the websites that I shared with you earlier. So if I need information about any drug, okay, right now we are using acetaminophen as an example. If I want to know the bioavailability, this can be calculated, okay? But if you are reading about, if you are using a drug reference book like the BNF that was shared on your platform, or you are using the drug information leaflet, all right, you see it there, okay? So let me increase it a little bit. So anytime you want to know the pharmacokinetic profile of any drug, when you type in the drug, whichever information source you are using, okay, if you type in the pharmacokinetic profile of drug A or drug B, you look out for what is written under absorption, what is written under distribution, metabolism, and then excretion. Okay, that will tell you the pharmacokinetic profile of the drug. So we are talking about bioavailability, and it is here that acetaminophen, the oral bioavailability, and they will always qualify it, whether it is oral, whether it is intravenous, intramuscular, they will qualify the type of bioavailability it is. So when we say oral bioavailability, we are talking about the bioavailability or the quantity of the drug that would be available when you use the oral route. So here we have acetaminophen as 88%, meaning that if I should administer if I should administer paracetamol to an average adult, 1 gram or 1,000 milligram, 88% of it is what will be absorbed into systemic circulation. Please, I'm repeating myself, and we are going to do a small calculation here. Okay, we are saying that bioavailability is the fraction of the drug that finally reaches systemic circulation. And I'm using paracetamol here as an example, okay? And we are getting to know that for paracetamol, the oral bioavailability is 88%. Okay. So if I say, now that, if I say calculate the quantity of the drug that will reach systemic circulation if a dose of 1 gram is administered, can somebody do the calculation for us to see? Can we try our hands for us to see? We know that bioavailability of the oral bioavailability of acetaminophen is 88%. And we are giving a dose of 1,000 milligram. Okay, I'm asking you to calculate the quantity of drug that will reach systemic circulation. Can somebody try and give me the answer? If you understood what I said, please try your hands on it and give me the answer. We are saying that the bioavailability is the fraction of the drug or the quantity of the drug that reaches systemic circulation. And we are saying for paracetamol, the bioavailability is 88%. We have a dose of 1,000 milligrams. What will be the quantity of acetaminophen that will reach systemic circulation? All right, I can see your answers. Okay, can see your answers. So I'm going to call Mary. She raised her hand first. So Mary.
So 880 milligram. That's what
Please,
I have.
can you tell us how you arrived at that?
So with 80, we know that the bioavailability of the drug is 88%. So 88 over 100. 88% of 1,000 will give us 880 milligrams.
So you divided the 88 by 100 and then multiplied it by the 1,000 milligrams. Great.
Yes.
And you arrived at an answer of 880 milligrams. Great. Thank you very much, Mary. So, please, do we get what we have just discussed? I hope you get it. Now, a few things, those who were able to answer the question, I saw some few things that I want to draw your attention to. Now, if I write this, okay, if I write 880 and I don't put any unit there, okay, I'm making it big so that you see what I'm talking about. I've written this